Hello and welcome to this edition of Albinism Life. I'm doing something a bit different this time round. When you go online and you Google albinism, you will come up with a load of bonkers, factually incorrect information. So you'll see like really weird images of people with blood red eyes and white powder skin, and just generally talking nonsense about the genetics and what it means. I thought it was about time to redress that balance and put something out onto the internet that was actually correct and represented albinism in an accurate way. So I sat down with the amazing Jay Self, who is a children's eye doctor in Southampton. So I'm just firing a load of questions at Jay, and he is answering them in a way that isn't technical and that pretty much everybody can understand. I hope you enjoy and join me at the end of this podcast. Let's start at the very beginning. Let's do a 101 about what albinism is.
Albinism is a bracket term for lots of different conditions that you can be born with, which all have one thing in common, that pigment is not produced in a typical way at the right time. There's lots of different types of albinism. There's more severe types where people struggle to make any pigment at all the way through to people who can look like me and have quite dark skin, dark hair, dark eyes, but still have albinism, and that generally means that they have some problems with their vision.
What typically are the issues that people with albinism have with their eyes and their vision?
So there's a few different things with vision, and all people with albinism don't have the same thing, which is why it's a bit confusing. The typical things which we associate with albinism more often than people without albinism are low vision. So the actual visual acuity, that means reading the chart at the end of the room, is lower. They often have too much light going through the iris, so the iris can actually look a little bit pink sometimes, or it can just mean that people have a real problem with bright lights. That's called photophobia. Also, people's eyes can move in a way that we call nystagmus, and all of these things are because of problems with the way the eye develops and grows, from all the way from the front all the way to the back. And in fact, it goes behind the eyes because the nerves which come out the back often cross in a slightly unusual way in albinism. And we're not sure how much impact that has on vision, but we do use it as a marker of whether somebody has albinism or not. So it's a useful clinical clue.
So just because you have a diagnosis of albinism doesn't mean you have to have all of those things?
Absolutely. So we have patients who have all of those things, and that's the textbook definition. So if anyone Googles albinism, they'll see someone who has no pigment, they have all those eye features, and that's the typical version. But increasingly over the last 20, 30, 40 years, we've realised there's lots of people who just don't quite have enough pigment at the right time. And what that means is they have often much less obvious features in the skin and hair. So as I say, they might look as dark as me. When the eyes were developing, they just didn't have quite enough pigment at the right time. They might have any one of those features I mentioned, or they might have another. I have families where we might have 2 or 3 kids with albinism, and they might all have slightly different versions. So one will have nystagmus, so eyes that move. 2 might not. One will have a real problem with bright lights. The other 2 might not, etc. So it's a bit of a mixed bag.
With albinism, is there any correlation generally with if you have more pigment, you're going to have better vision? If you have less pigment, you're going to have worse vision. You're going to have more of the features of albinism. How does like the amount of pigment you have relate to how you are affected in terms of your eyes?
That's a really good question. So there is correlation. People who have the least pigment overall, in a big sort of bracket way, tend to have the worst visual signs and symptoms. And people who have more pigment, generally the visual stuff is a little bit better. But that's a huge generalization because I have patients who break those rules all the time.
When babies are born, how are they diagnosed with albinism?
So this is still quite rare. We don't exactly know how rare it is, which means that midwives and paediatricians aren't necessarily looking out for it. It's not a thing that they see every week. Often what we find is that children, if they have a more severe form of albinism, as soon as they're born, just their colouring is suggesting that there might be something going on, and so that sparks a referral. I would say more often than not that isn't the case, because if you have parents who have fair hair and fair skin, they wouldn't be surprised by a child who's quite fair. And quite often in those scenarios, kids come to us when they start to have a problem with vision. And that often is the nystagmus, actually, the eye movement. And that eye movement, interestingly, usually only kicks in at about 3 to 4 months of age. It doesn't tend to be there before that. I would say probably the commonest presentation that we get for children with the question mark, have they got albinism, is about that age when the eyes move. And in fact, the question is usually, why are their eyes moving, rather than have they got albinism.
When parents with little babies come through to you at the hospital, what should they expect?
It will depend a little bit on which hospital you go to. We're a big centre who specialise in it, and we do quite a lot of work to try and get other slightly smaller centres to do things in a structured, organised, logical way. But the sort of things people would expect, so from our albinism specialist clinic, the child would come in, they'd have a few special tests. One of the first things is they will see what's called an orthoptist, so this is an eye movement specialist and a vision in children specialist. We'll do a whole load of assessments checking the child or baby's vision in lots of clever ways and looking at the way their eyes move, documenting features of the nystagmus if there's nystagmus present. They'll see that person. They'll then have some other tests which might include a thing called an electrodiagnostic test, where kids have little stickers on their heads and little wires hanging off. It all looks very exciting. We don't electrocute their brains. What we're doing is measuring their brain response to what they're looking at on a television screen. And we also have some little stickers here as well. We're actually measuring the eye's response to what they're seeing. And those are called electrodiagnostic tests. And the two types, at risk of being boring, are called VEP and ERG. So these are terms people might hear. One of the other tests we might do is what's called an OCT scan. This is a really super detailed image of the retina, just to see if there's any cause in the retina for the wiggle, if that's why they've come to us, and also to look for the typical features that we see in albinism. Typically in albinism, the retina doesn't form in a way that it does in other people, and so they don't have a little dip at the back that we call a fovea. We're specifically looking for lack of a foveal dip. So that's on this special test called an OCT test. They might also see an eye doctor, then have a history taken, talk about all the findings that we've got, and often they might then be sent for genetic testing as well. So it's often quite a lot. Now, in a big sort of specialist centre like ours, we try and do it all in one go. The benefit is they're not having to then travel down, 200 miles for multiple appointments. What you might find in slightly smaller units is you might see an eye doctor and have some of those tests, and then they'll say, well, let's send you away for some of the others.
You talked about the OCT and looking at the retina. What role, so if you don't know anything about eyes, what is the retina?
So the eye is made of lots of very clever structures, a little bit like a camera. The way to think about it is like an old-fashioned camera. So you've got fancy lenses at the front, and that's like the clear bit at the front of your eye called the cornea, and the lens inside. And the lens is the bit that goes cloudy as you get older and turns into a cataract. These are all the kind of focusing things at the front of a camera. And then at the back of a camera, you have a film. These days, obviously, it's a chip, but in the old days, it was a film. And that film is the equivalent of the retina in the eye. So the back of the eye, the inner wall of the eye, has this very sensitive, very clever bit of tissue, which converts light into brain waves. And those brain waves is how you see. So the retina is a really important bit at the back of the eye, which is completely necessary for vision. If it doesn't develop fully, then that can be a sign of certain eye problems, certain causes. And in albinism, that absolutely happens. The OCT scan is a really good, detailed way of looking at those little things that we're trying to spot to see if someone's got albinism or not.
And because albinism is rare, sometimes parents, they'll go to their local hospital, and when the child is diagnosed, it's not always a positive experience. Parents are told that their children will be blind and that they won't be able to see. Is that the case in albinism?
It's difficult, and I think it's unfortunate because for most conditions which aren't super common, sometimes the information people get at the start isn't necessarily the most up-to-date or accurate or tailored for them. So I hear that as well. I hear that a fair bit, as you know. The honest answer is when we see a young child and we think they've got albinism, the most likely thing is that their vision will be an issue for them. But the details of that are quite hard because, as we said a minute ago, it's quite a wide variety in terms of what eye features people have with albinism. And some will be right at the sort of better spectrum, and some will be quite poor. So at that stage, it's very, very hard to say whether that particular child is going to be one or the other. So generally what I say to parents is, from all that we've seen, we think they have albinism. We've seen these features in their eyes and their retina. What this means is that their vision won't develop typically, so the vision won't be as good as somebody without albinism. But the idea is we're going to maximise, get them as close to that excellent vision or as good vision as they can get. And throughout their life, their vision will be something for them to think about, but hopefully not dictate everything they do. But the honest truth is, at that stage, we can't say 100% what their vision will be reading a chart or navigating around a room or trying to cross a road in 20 years, but we know their vision won't be typical.
For some children, there is the potential that they'll be registered as severely sight impaired, and for other children there won't be because it's a spectrum.
Yeah, absolutely. So most will be registered in some way. So the certificate of visual impairment is a two-step process in the UK. You're either registered as sight impaired, meaning that you have something about your vision which isn't typical, or you're registered as severely sight impaired, which is the old way we used to register people as blind, if you like. People with albinism very, very rarely have no vision at all. So being completely blind in albinism is extremely rare and usually related to some other thing, actually. However, there is a huge variety of what the vision will be within that. What I would say is that most children we register as sight impaired, meaning they've definitely got something there that's extra and they need some support and some help, but we don't go to the severely sight impaired, and I don't often have to register people at that level. But it does happen, and it's often when people are a little bit older, when we just have a bit more detail, to be honest.
And are there any treatments? Is there anything that can make vision in albinism better?
So there are parts of problems with vision in albinism that we can help with, and there are parts which are fundamentally the way the eyes and the brain have developed, and we don't have any clever treatments for those. So underlying the poor vision, or the lower vision in albinism, is that the retina hasn't developed typically, and we can't do anything to correct that. What also happens in albinism, partly related to that perhaps, is that refractive errors are more common, so needing glasses, having slightly complex glasses needs are more common. Strabismus or squint, where the eyes look in slightly different directions, is quite common. Having a lazy eye, so this is why children sometimes wear a patch, is more common. Sometimes having a head posture is quite common if you have nystagmus. So often when people's eyes move, they hold their head in a particular position because their eyes move less when they hold them looking leftwards. All of those are parts of albinism that we can do things about and we can help with. But it's important to remember we cannot fix the underlying fundamental problem with development of the retina and the brain in terms of vision.
People quite often think that surgery fixes things. Having an operation will make everything better. Is there any surgery that you can do for people who have albinism in relation to their eyes?
Yeah, the only surgery really that we do in albinism is for that head posture that I mentioned. If you're a person with albinism and you have nystagmus, you're likely to have a direction of gaze where your nystagmus is least. If your vision is better in that direction, and often, interestingly, it's not about reading the chart, it's about how quickly you see things, we think. If patients clearly have a benefit of looking in that direction, they hold their head in certain head postures, we can do surgery on the muscles of the eyes to try and move that preferred bit to the middle, so they don't have to walk around with their head in an unusual position. And the reason that's important is that if you walk around with your head in a tilt the whole time, sometimes you can have problems with your neck, you can get headaches. But more importantly, it comes at a cost because of those things. So often people then just don't adopt it. They don't adopt that head posture, and therefore they don't use their best vision. And we want kids using their best vision. There are no surgical treatments for fixing the retina or fixing the problem with the nerves that cross behind them, or really for the nystagmus itself.
Albinism is genetic. Can you tell me about the different types of albinism? Can you talk me through the genetics?
Yeah, of course. So there's quite a few different types of albinism, and it gets complicated very quickly, is the first thing to say. As I said at the start, albinism really is a bracket term for a group of conditions which are all related because one of the major features is that they don't have enough pigment at the right time somewhere in the body. Now, typically, albinism is broken down into two different types. So there's ocular albinism, meaning it only affects the eyeballs and has all those features we mentioned before, but has no effect elsewhere in the body. And the genetics of that is slightly complicated in that it tends to be boys because it's on the X chromosome. Now, that, in fact, is much rarer than people think. What is much more common is what's called oculocutaneous albinism. Within oculocutaneous, there's two main types, one called syndromic and one called non-syndromic. But the syndromic means it's hair, skin and eyes, but also affecting something else in the body. So that might be blood clotting or infection. And that, again, is really, rare.
When people have OCA, oculocutaneous albinism, so how is it passed on?
So oculocutaneous albinism is caused by a few different genes. These genes are things that we all have. In our DNA, we usually have, for every gene, which is like a little packet of DNA, usually have 2 copies. So one from your mum and one from your dad. And that's true for all these albinism genes that we're talking about, oculocutaneous albinism. Now, typically, if you have a spelling mistake in one of those copies from one of your parents and not in the other, that means you're just carrying albinism and you won't have any features. However, if you inherit one spelling mistake from mum and one from dad, so you've got a spelling mistake on both your copies, that's when you get albinism. And so it's called a recessive condition for that reason. And what that means is, for mums and dads who both carry one of these spelling mistakes on one of their copies, they would have a 1 in 4 chance of their children having albinism. There are some reasons why it's a little bit more complicated than that, but that's the general principle for oculocutaneous albinism. So it would be 1 in 4 children, but things don't always come from mum and dad. Sometimes they can start new in a baby, so this is why genetics is important. People always think that inherited conditions have to have gone through the family tree all the way back to Adam and Eve, but they don't. They've all started somewhere, and they can actually start in that individual with albinism for the first time.
So if 2 people with OCA have a child, what are the genetics with that?
That would depend on whether they both have the same type of OCA. If they've both got spelling mistakes on both their copies, as I mentioned, which they will have, of a gene, one of the albinism genes, if they've both got spelling mistakes in the same gene, then we would expect all their children to have albinism, actually. But if they've got technically different genes which are causing their albinism between mum and dad have got different versions, so one might have OCA, one might have OCA2. They're different genes, so we'd expect their children to inherit a whole load of albinism genes, but it would be less predictable as to whether they'd have albinism. And technically, from a pure recessive model, we'd expect them not to get albinism. But it's quite an unusual scenario, and it can be a bit more complex.
When you have a child who has just been diagnosed with a genetic condition, it's a really stressful time for parents. You know, parents are feeling vulnerable and they're worried about the future of their child. Obviously, as we've spoken about, vision can vary, but what kind of prognosis, what do you say to parents when you offer them that diagnosis?
So what I say in terms of vision is that the vision is not going to be typical. For little Johnny or little Sally, their vision will always be something they need to think about, but it's not going to dictate what they do. It's not going to dictate every part of their life. Almost every career is open to them. You'd expect them to do all the normal things that children do, but they'll just have a few extra things to think about with lots of activities. For example, they're unlikely to be a fighter pilot because their vision's not going to be good enough for that. But I have friends and colleagues who do amazing careers with albinism, just with some adjustments and needing some help with a few extra bits and bobs. And they often then kind of lighten the mood, if I'm honest, and say things such as, when they get to, 8 and 9 and they refuse their broccoli and don't eat their spinach, that's not because they're their albinism. There'll be lots of things which they do which are very normal for every child and young adult. The albinism is not dictating everything.
So if your child, if you are suspecting your child has albinism and you're waiting on that appointment to come through from the ophthalmologist, what would you recommend people do in the meantime to kind of reach out?
Yeah, so reaching out, I think it's important to think about where you get your information from, like with all things on the internet. I think there's some really good societies. So the Albinism Fellowship are fantastic in the UK. They've got really good information. They work really closely with us and lots of other people who deal with albinism all the time. And so their information is fact-checked, makes sense, and is sensible and practical because it's run by people with albinism or parents of people with albinism. So seeking out resources like that. But the Albinism Fellowship is fantastic.
Thank you so much for tuning in to that episode. I really appreciate it. And I hope you are now armed with all the information that you need about albinism, whether that be for personal reasons, professional reasons, or you're just curious. So if you would like to get in touch with us, please email info@albinism.org.uk. And if you'd like to get in touch with Jay, please get in touch with us and we can give you more information. I'll see you next time on my podcast. Bye.